So the ACEs was developed because what we began to see is that people who had adverse childhood experiences, and by the way, I mean, I could pull it up. This category is very strict. It's 10 things off the top of my head because I should know this after all these years. Did you experience abuse, physical abuse, or neglect as a child before the age of 19? So this is a checklist before the age of 19.
Mhm.
Did you experience physical abuse and neglect? Okay. Did you experience a divorce or separation of your parents before the age of 19? Did you experience death or suicide in your immediate family or in your community before that was impactful before the age you go, right? Imprisonment, sexual abuse. And so substance abuse. And so those 10 questions. And what we found is that anyone that ticks even half, because really think about it, those are all traumatic things
Right.
of this adverse childhood experience assessment, those people would have not just mental health, a heightened or a more of a chance of suffering from various mental health problems, not necessarily severe, but mental health problems.
Right.
Those people would also have significant health care problems,
Oh,
physical health care problems. And so the ACEs became very, very important because, and then the majority of people that would check, of course, all of these boxes. Often I have patients that check all 10.
wow.
They are usually Black women.
Hey, everybody. Welcome to Unapologetically 50 Plus. So, this is going to be our first episode of our new monthly series with licensed clinical social worker and therapist, Ms. Temple Jackson. You've seen her on here before. She is my therapist. And so, we are going to do monthly episodes on different topics such as sexual trauma and healing, grief and family dysfunction, and what might be keeping you spiritually stuck. So please come back each month and join us for these really interesting talks. But today we are going to talk about depression and the silent killer. But before we get started, I have one huge favor to ask. If you find any value or enjoy the content, please remember to like and subscribe and hit the notification bell. I truly appreciate your support. All right, so let's get started with this conversation with Miss Temple Jackson. Hey, Temple.
Hi, Angela. It's really nice to be here with you again. And thank you for having me. And hello to everyone that's watching and or listening. I hope many more people find this interesting, this idea of once a month, ask the shrink, just ask the shrink.
That's the strength. And
Um,
listen, you guys will, if you guys have questions, I'll just say now, put it in the description, or excuse me, put it in the comments. And then, this will be something that Temple could answer the next time she's on. So please, if you do have questions, put it in the comments. I'm sure she'd love to hear from you guys.
Absolutely. And there's a live you just informed me that we're going to go live the next time we do one of these, right? Ask the shrink. So that would be also a great time for people to write their questions in real time,
Exactly.
about anything, any mental health questions they might have, anything from eating disorder to, historical family trauma, everything in between. Maybe it's about the psychology of working with bad bosses.
Oh,
Uh,
okay.
yeah, so who knows, right? In
Oh,
the future.
so let's start with this
Mhm.
depression. Why is it called the silent killer?
Thank you. So I am so this was the topic that I wanted to discuss with you today. And without revealing confidentiality of the wonderful clients that I work with,
Yeah.
I lost a patient this week. Her family lost her, a community lost her. And I'm thinking about historically how many times we've lost someone beautiful, someone powerful because of depression. Whitney Houston. We can go down the line. The rock star, she died recently, about a year ago. Sinead O'Connor,
Oh,
Mama Judd. They all died in
mhm.
some form or some way of depression.
Oh, wow. Okay.
And depression is the silent killer because there is so much stigma still attached to depression,
Mhm.
so much negative stigma still attached to mental illness.
Oh,
And
okay.
so we hide depression, right? We try to disguise it.
Right.
Mm.
Right. Wow. So since this, um, what am I trying to say here? Since this channel is predominantly for, women over 50 and in particular Black women, in your work with Black women over 50, have you seen grief disguised as depression?
100%. And I think this is where it's important, right? Clinically, as we discuss this through the clinical lens, to
Mhm.
also rope in real stats, right? Real statistics about how depression, grief, and then what comes after that can lead to very, very, very serious and oftentimes fatal consequences. And
Mhm.
so, what I'm talking about, right, is the suicide rate amongst Black women in this country
Mhm.
in comparison to other groups. Um, what often presents as depression is unprocessed grief, right? So all our lives we're being forced to stuff so many things, even stuff the very essence of who you are. Um, and I hear these statements, from women, it's too late now. I miss my window. I don't have it. I'll never have the things I want. These women are usually women who carried their entire families, their churches, their communities, and even whole movements um, without ever getting their own personal and spiritual and emotional needs met. In fact, many Black women, right, just carry the back of and by the way, I want to say many women of color,
Mhm.
many marginalized groups of women carry the backs of success, the pressure of success on their backs, excuse me.
Right.
Many of us have endured lots of historic cultural and racial trauma. We still persevere, we still rise, but in that we're often still stuffing the grief, stuffing the pain, and grief can calcify into numbness and exhaustion. And then we eventually would clinically label that as depression. When it starts to calcify,
Mhm.
that's when we should be very concerned because a woman is more likely to go inward. And by the way, I'm not going to fake the funk with the guest. I have some notes up here. I took because I wanted to have some good stats for this conversation.
Of course, of course.
And I'm gonna turn it back over to you, but this for me today, I'm actually quite sad. And So the role of silence when it comes to depression.
Mhm.
Last thing I want to say, we are also very culturally guilty. And we see this in Indian families, Asian families, first generation African immigrant family, Latina families. We are culturally guilty of denouncing depression, of not making a place for it, and of even right? We marginalize our own people who suffer with depression and with mental illness.
So, how do you help women name that grief and begin to honor it rather than suppress it?
Mhm. I think it is so important. I was thinking about this earlier. I think it is so important to give women a place, a platform, a space
Mhm.
to tell their stories, a safe place to tell it all out. I'm one of the therapists that believes in long narrative therapy. I believe that many people need to tell the stories, to say exactly what's causing them pain and to be validated in that, you know? And people need warmth. They need love. But we are very busy going around comparing ourselves to others, and we're very busy being in competition with each other. And we're also very busy judging people. And we often judge people on any first or individual random presentation they may have. We have actually stopped taking the time to go deep, to find out who people are and what they need, and how we can help care for them.
And when you say long, you said long narrative.
Yes. So one of the things I do is when folks come to me and they have a history of uh, adverse childhood experiences. This is called the ACEs. And the ACEs is a clinical assessment. And we came up with the ACEs because everyone, what we had so much, we had such a problem with fair and equitable treatment in the medical system. And we also had many practitioners and providers that didn't know anything of the historical background or the systems perspective in which their patients were coming to them. So the ACEs was developed because what we began to see is that people who had adverse childhood experiences, and by the way, I mean, I could pull it up. This category is very strict. It's 10 things off the top of my head because I should know this after all these years. Did you experience abuse, physical abuse, or neglect as a child before the age of 19? So this is a checklist before the age of 19.
Mhm.
Did you experience physical abuse and neglect? Okay. Did you experience a divorce or separation of your parents before the age of 19? Did you experience death or suicide in your immediate family or in your community before that was impactful before the age you go, right? Imprisonment, sexual abuse. And so substance abuse. And so those 10 questions. And what we found is that anyone that ticks even half, because really think about it, those are all traumatic things
Right.
of this adverse childhood experience assessment, those people would have not just mental health, a heightened or a more of a chance of suffering from various mental health problems, not necessarily severe, but mental health problems.
Right.
Those people would also have significant health care problems,
Oh,
physical health care problems. And so the ACEs became very, very important because, and then the majority of people that would check, of course, all of these boxes. Often I have patients that check all 10.
wow.
They are usually Black women.
Wow. Okay.
Okay. All right. And they're Black men too. But the reason why I say usually Black women is because Black men are not likely to see a therapist. And that's just the truth. And in fact, most men are not. But, for the purposes of this conversation around Black African American statistics.
Mm. Wow.
So the ACEs are important, right? Because
Okay.
the ACEs can be life or death
Wow.
in your later years.
Okay. Um, So, what role does silence play in depression for women, and in midlife, and not just silence from others, but also their own internal silence?
Yeah. I really dislike silence. I want to say this. I think silence um, is too close to cowardice for me,
Why do you say that?
because when we are quiet,
Mhm.
when we know something is wrong, people get hurt.
Okay.
And I think that we are often quiet because sometimes we lack the courage
Mm.
to be that one individual that speaks up, right?
Right.
So this silence is a problem. Silence is both survival and suppression, right? And silence. We can use silence as survival, and that's really important. But silence is often suppression, which is what I've talked about. And many Black women, you know what we were taught? Keep it together,
Right.
keep it quiet, keep
Right.
it in the
Don't
family.
keep it in the
No,
family.
keep it
Exactly.
in the family no matter what. So
Right.
we learn how to silence our pain, our
Mhm.
boundaries, our discomfort, and our joy. And this is one that I really know about. If you know me personally, even if you've known me 5 minutes now, I always maintain that as a therapist, and you at least have some experience with this, it's quite serious in the therapy office, in the therapy space. But I'm a joy-filled individual, and I'm loud with it. I always say I'm a modern day Phyllis Diller. And right, I mean, really like Pee Wee Herman, Phyllis Diller, Lucille Ball. That's me.
Right.
But that joy has been that very sense of joy and outwardness in me has been stomped on my entire life.
Mhm.
Joy scares people, right? So women who have big bravados and big voices and or big pain, we learn how to be silent around it, be out of protection, and at some point we are suppressing it. Over time, that inner silence becomes self-abandonment. Depression often grows. I know you want to say something about that.
No, I was going to ask. So when you say like some women or especially particular Black women, we have the big voices but we're told to silence that or keep it down, tone it down. Do you think that has anything to do with our history as women?
100%. 100%. Look, I got so excited about that question. It does, right? Um, our the way we respond, we were taught first of all, we come from a life of having to sneak around. We come from a history of being quiet, small, low to the ground. And by the way, that's in my book. So if someone tries to steal that line, you will be
Ah,
no, but it's true, right?
okay.
And listen, I know I was born in the 60s, 1965. We were still born during a time that segregation was active.
Right.
Yes, and there were so many reasons and times that we were told to be quiet, be still, right? Not
Behave,
a, that's it, and
behave.
also that's it. And we come from the era of needing to get off the street, sundowners. Get out, get off the street, right? Because it's not safe. So yes, I do believe that we have inherited a way of managing our behavior, our voice, of quieting that. And honestly, I can't think of anything more painful than being silenced,
Being silenced.
right? And I can't think of anything more painful than having to be silent about something that hurts so much, something that you're so confused about, that eventually you might have a psychotic break,
Mm.
that depression, right? It certainly leads to people doing things such as overeating, gambling, sex addiction, over
Mhm.
drinking, drug addiction.
Right.
And lots of us understand those things because many of us have been there.
Mm.
So back to the narrative, right? I think it's important to start at stages. So I typically would send a patient home and say, your homework is to bullet point
Mhm.
any significant memories that you have, starting with the earliest. So we usually say around age 4, the age of 4 to 8. And I just ask them to bullet point because then we'll go from 8 to 12 and from 12 to bullet point those significant memories. And we take each one and I allow the patient to discuss it. And during that time, I ask the patient, usually a Black woman, because I work primarily with women of color, not just African American women, but women of color, people of color. I ask them to take their little girl, get their little self, and walk them through that memory and tell it, unpack it now. And that can take sometimes over a year.
Oh, okay.
Mm-hmm.
So how does, sisterhood and community, we already know, how therapy can help, but sisterhood and community, how can that help women break that silence without the shame?
Okay. So the deal is depression grows in the spaces where we stop telling the truth. Depression grows in the spaces we stop telling the truth to ourselves and to others.
Okay.
So in terms of sisterhood, this is where, in my opinion, it has this is where for me tribalism is a problem because it has to then be more open, less exclusive,
Okay.
right? More open, less exclusive. Frankly, I'm really looking forward to a world where any woman can see the pain of another woman
Mm-hmm.
or see the shortcomings or see the fear of another woman or the struggles or the stumblings and say, Sister, you look just fine to me. You are doing great. Oh my God, thank you for being you.
Yeah.
You know, we've got to actually spend some quality time with each other,
Mm. Nope.
which means we might have to let go of some of the fear and the anger and the suppression we have within ourselves because no one ever heard our story. I've got problems too.
Right. Right.
I mean, I want to give you an example of that.
Okay.
And I don't want to go too deep. I don't like to get into my personal life. But some time back, I shared with a woman about sexual assault that I had endured.
Mm-hmm.
This was a Black woman.
Mm-hmm.
And she said, quote, "You're not the only one who has gone through things."
Mm. Mm.
And I remember immediately understanding that there was such a pain or such a, like a lump of coal in there for all the things that she had been through, that giving any amount of empathy
Right.
felt like competition or something was being taken away from her.
Mm.
That's got to stop.
Yeah.
And we are all responsible for that.
Wow.
Hmm. That wasn't actually so long ago. That was a few months ago.
Wow.
Yeah. Yeah. So in that moment, my story becomes insignificant, right? And
Right.
I think that
Right.
happens to us a lot. And then you turn the depression back inward if
Right.
that's something you're struggling with.
Or you
Trust.
don't, acknowledge it again or tell it, or you keep, like you said, you keep it inside and you don't share it again because you shared it once and that was the reaction you got. So now you don't feel the need to share with anybody else. So you're, again, it's internalizing.
Yes. Then you're back to the self-fulfilling prophecy of this inherited legacy of survival, right?
Right.
We're back to um, this trauma that continues to live generations upon generations upon generations within us.
Right.
Listen, I am clear. We have the power to crush this.
Right.
And the prescription, The recommendation is love.
Okay.
Love.
And sometimes that's easier said than done.
Mhm.
I mean, honestly, it is because we live in a culture that doesn't really show the type of love that you're talking about, that really deep.
Open-hearted love.
Right. It's not across every, aspect of our culture, but
Sure.
it it's just a lot of the love that we receive is superficial
Hmm.
in your own family. It's not that love that you're talking about. So, I mean, I hear what you're saying, but that honestly is hard for a lot of people to give that genuine, non-competitive love. So that's why I'm always an advocate, even if you don't think you have, you know, issues or things you want to discuss. Therapy, even if it's you start to dig, you especially if you have a good therapist, you have that therapist will ask and pull out things that you're like, wow, I never really saw that as an issue, but now that I'm really taking a deep dive, I need to work on that. So I'm
Mm.
always an advocate for,
Yeah.
getting therapy, even if you think, oh, that's superficial, I'm okay. You might not be. So I think therapy is amazing.
I'm really so happy to hear that. Your therapist might ask you to name your super ego and bring her to session next time, right?
Yeah.
Um, but I hear you, I hear you say that tapping into that open-hearted love is hard. And that is exactly what I'm talking about. It shouldn't be, and it doesn't have to be. Now, I'll tell you, I get it because I give a lot of love.
Mhm.
And oftentimes that love is not appreciated or not coveted, right? Not held safely.
Right,
I can't let that stop me.
right.
I have chosen to be courageous around that.
Yeah,
And maybe just maybe someone will follow my lead.
yeah.
Um, but yeah, I wanted to share a stat with you. So this is according to the Journal of Affective Disorders. African American women who are significantly more likely to experience chronic, untreated depression rooted in generational trauma
Wow.
and socioeconomic stress than any other group of Americans.
Wow.
Right. So that's why ultimately we're talking about this through the lens of women of color. We are both women of color. We are both Black women. We turned out a little beige, but we are both Black women.
Right.
And right.
But don't get it twisted. Society still sees us as Black women.
Boy, they, right? Even if you have a Jewish like me.
Exactly.
We are Black women, and this is exactly it. And so simple things that we can do, not ostracizing or separating out ourselves from other Black women, understanding that we all have a story. We all, if you've come up in America as a woman, as a Black woman, particularly from the time that we were born and raised, you are coming with a story of trauma. And by the way, I hate that. I don't want that all of us, it has nothing to do with how you present. You can still be happy, still be great, still rise, still be successful.
Yeah.
But that is a part of our story because if you're sitting at the counter eating and minding your business, you might just get caught out for eating while Black.
Right.
Yeah. you know I
Yeah.
mean, I don't go around talking about some of the things that happened to me as a Black randomly, like the woman coming up to me in the grocery market a few years ago. I had my dog Rocco and saying, you're not supposed to have your dog in here. She was about my age.
Hmm.
And I mean, there I was, being policed for the 100th time, and people with their phones out, and I just said, lady, please leave me. Please get out of my face.
Right.
You know,
Right.
not interested. I'm not interested in calling the police or anything. This is an everyday thing. Don't know why we're off on this tangent. Right. So when we know that we are experiencing, right, these things in the public, and this just, trying to be you, that competition is already there. We don't need it amongst our sisters.
No, we don't.
Yeah.
So going back to, and you kind of touched upon it just a few minutes ago. So do you believe depression can be inherited, and not just biologically, but emotionally and spiritually?
Is inherited. Yes, 100%. Thank you for asking. This is an important question, right? And folks need to hear it. There are a number of things that are genetically inherited that we know science is solid, right? And what does science mean? It means that we've done the research over and over and over again. So it would be the same study over and over again. Each time, different population of people, different country, different, and the same results. We yield the same results. So that makes a study valid and reliable,
Okay.
right? Um, I'm gonna give you some things that you'll be surprised of that might be inherited. Trauma, depression, mental illness, really, which is all of that. That is one of them. What else can be inherited? Tell me something that you can think of that you're aware now that you think of it can be inherited.
Are you talking about for therapy or
Down
just
to families, yeah, inherited, passed over genetically, passed forward.
now you caught me. I didn't know
I caught you out there. Okay.
right, I didn't know I was gonna have a quiz.
Okay. Substance abuse.
Oh, okay.
If your mother or father struggled with substance abuse, alcoholism in particular, or any substance abuse, the children are 10 times more likely to have substance abuse problems.
So let me ask you this real quick.
Yeah.
So when you say they can inherit it, are you talking about biologically, or if you're in a household and you see it?
Oh, now you're getting deep. Now,
Well, that's what I'm
okay.
wondering because
Okay. So
because
I am, yeah,
I was
go
going to say,
ahead.
because I was adopted. My biological mother was a drug abuser.
Okay.
But since I was adopted into another family, I never saw that. So are we talking that biologically I could have inherited that? Because I'm, very
You,
much
you're,
not.
you're not raising your hand as a drug abuser?
No, I'm not.
No.
But so as I'm asking, can it be, you're talking about
Question.
biological
Yeah. It's a great question.
or both?
So both. So, but actually at this moment, right, I'm talking about biological, so
Okay.
genetic
Okay.
transference of these things. Having said that, you, Rose, listen, if we get anywhere to the end of this interview today, knowing anything that we said, that is going to be really great. I have a feeling we'll get there. But you raised a very important question. What you did was raise the psychoeducation, the psychology question around nature versus nurture, right? Nature would be genetics and nurture would be social impact, learned experience, right? And this is a wonderful, very, very complicated topic, and there is no one way or the other. But it is true that you could be adopted, you could have been born of an addict mother, let's say, and be adopted out into a healthy social situation in which none of these addiction or alcohol or substance abuse is not modeled and never have those problems because the nurture would have really taken hold. But I want to be really clear that you could be adopted out having been born of an addict the same way into a wonderfully nurturing family and have all of those problems because of the genetics.
Oh, okay.
Okay? Nurture does not always win the genetic game. The
Okay.
point is, you did great,
Mm.
but 4 out of 5 people, possibly, and I might be stretching that stat, maybe it's more like 3 out of 5, who have the same circumstances would have the genetic pull leading the show.
Wow. Okay.
Yeah. No, it's very so. And here's something fun. So if we know that mental illness, right, and you know this, just think about people you know,
Right.
right? Just think about people you know, the mother, the father, there was stuff there. Then it's right, domestic
Right.
violence. All these are behavioral things. Talent is inherited genetically.
Right. Mhm.
Think about it, right? It's not
Yeah.
just by happenstance that all of the Jacksons got talent. It's
Right.
not by happenstance, right, that Nat King Cole and Natalie, right?
Right. Okay. Yeah.
We know this. We know this from performers, actors. A talent is actually genetic.
Okay.
So it's really powerful. Of course, you could have no one with talent before you and still have talent. Um, Mental illness, talent. Some there is some science behind intellect, right? Intellect is inherited. Yeah. Some believe that evil is inherited, but I have never experienced that in my personal clinical life.
Wouldn't be surprised. I mean, if everything else,
Yes.
why can't that be?
Sure. I just, don't have any stats, but I'm sure it's there. I want to recommend for anyone that's listening today, any Black woman, any Black man that wants to get some more really solid and research solid information about inherited historical trauma. They should check out Dr. Resma Menachem. And I don't know if you know who this is. This gentleman is the founder of somatic abolitionism. And he writes, he is probably the best, he is probably the best professional on this topic, the most educated person, in my opinion. There are probably many more people, but he talks about how we can't carry this anymore and how the answer is within us and not in the constantly pushing outward the pain,
Okay.
right?
I'll get
But
that information from you and put it in the
yeah, absolutely. Yeah.
so anybody who's interested can look that up.
Yeah.
So how can healing one woman shift an entire lineage? Can it?
I think so. I think so. Think about think about what it does when a small village in Africa, in in the middle of Asia, puts
Mhm.
together their resources, that things have been so hard and so trying,
Mhm.
and they see this one child, right, this one person, as a person that can take them by pouring all of their love and their resources in this person. They can go on and do something big in return, bring it back to the community, bring it back, right, and certainly pass that sense of love, of success, of being nurtured, being cared about, being cultivated.
Mhm.
They will pass that off to the generations that follow them. But we also take that back to the places we come from. So I think we should give women love one woman at a time if you have to, but not based on what your idea of love is, but always love is based on how the person who's in need says they need to be loved, right? It's oftentimes we love based on what we think is love. I'm going to, Venmo you $100. I sent you a cake in the mail, or I answered your text.
So when you say that, it made me think of someone was telling me that in their relationship, I was receiving what they thought I wanted in the way of love or, um, love, since we're talking about that, but that wasn't the way I wanted to receive love. They were giving me the love. They were giving me love the way they thought
As
I
they
wanted,
understood it.
as they understood it, instead of
Mhm.
asking me. So they would give me you know, flowers, and like I don't like flowers, I like plants. But they were, yeah, they were giving me the love the way they saw it, but that's not how I wanted to receive it. And instead of asking, they just assumed, or, and then if you don't receive it the way they think that you should receive it, or they don't feel that you're being grateful, then that's a whole nother issue, because they're like, well, I gave you this. Isn't that how, I mean, I'm telling you I love you by giving you this. But it's like, but that's not what I needed, from you. So is that kind of what you're kind of saying?
Yeah, absolutely. I mean, I'm thinking as you're talking about that, what Marshall Rosenberg would say, right? Because
Oh,
it's, yeah, right,
yeah,
about nonviolent
fun.
communication.
Right.
Absolutely. Listen, as a therapist, I personally don't choose not to work with couples. I do some couple counseling, but it's by request only because couple counseling can be brutal.
Sure.
And the right, I it gets bloody. And when the couple, in couple counseling, couples, this is exactly it, right? And I'll answer that question. But when the couple is tearing each other down, if they're in counseling, they take the therapist down. If they have children, a family, they take the family down. They take the community down, right?
Yeah,
The
yeah.
couple together, because all of us have this, our unique stuff that we enter into the relationship with.
Yeah.
And if it started with wound meets wound, now we've got a stage 4 pressure ulcer.
Yeah.
Yeah. Okay. So that's why I stick to individual counseling. But that's it. What do couples bring to the table? It's always like, no, I did give you love.
Right.
You have a new car. You have a, you
Right.
know. Um, but what we're not doing is asking questions. Literally, one of the most romantic, loving things that a partner can do is ask you how you want to be loved. I want to give you some love today, and I'm not sure what you need, so I thought I'd just ask you. The other side of that is if you're not being asked, if you don't feel like the love you need is being recognized or engaged or being met,
Mhm.
you too, under the scope, the teachings of nonviolent communication, have a responsibility to figure out some way to sidle up to good intentions, we hope, and say, I like this blouse, but what if I asked you to rub my belly instead? And that when you do that, I feel tremendously connected to you. Or you probably didn't notice that I really love plants, but let me tell you why. Let me tell you what a plant means to me.
Mhm.
Yeah. So, right, we have a responsibility.
Right. Exactly.
Yeah.
So, how does the feeling of being used up or no longer desired impact emotional health in women, especially those of us over 50?
Yeah. Yeah. Uh, this is a thing. I can, I can feel it. I had a funny thing happen the other day about this. I had some friends reach out to me and say, let's get together for dinner. Um, Here where I'm hanging out in New England. Let's get together for dinner. And then they wrote back. I wrote. I thought it was a different friend writing me, and so I wrote, "Great." She says, "I'm going to invite these people," and I said, "Yes, that sounds great, but I just want to be really clear. I don't want to pay for dinner for 10 people." But I sent the message to the wrong person. And the other person got the message, said, I would never do that. And I was just like, yeah, but sorry, wrong message, but people do. They use me up all the
Oh,
time.
yeah.
But there is this, so that is a devastating feeling, right? We, and we might even as older women be running some of that competition to still fit in, right? Fit in, be a part of.
Yeah.
Um, um, Especially as we continue to age in within a culture that's obsessed with youth. Many of us continue to feel invisible. And that's when I talk about possibly doing more than we need to do. And I'm certainly guilty of that, trying to continue to stay relevant and not invisible. Um, and we've spent our lives trying to find our value through other people's approval, including our jobs. And many of us feel discarded. I think many women over the age of 50 begin to feel a little bit discarded. And I don't mean to say for all and all the time,
Right. Right.
but yeah. And so that feeling of being used up at being at the end of your job, you've been there 30 years, 20 years, you've got family, and it's the same thing. I think there's such a tremendous invisible burden of responsibility that even us women haven't begun to unpack completely.
Well, one thing I get tired of hearing, since, I do peruse, particularly YouTube, and I just get so tired of hearing, and that's why I'm glad I'm not single. But you have a lot of men now who are in their 50s who don't want to be, and it's not all men, but
Mhm.
they don't want to be bothered with older women because they got too much baggage and they got too much this. And, I don't want to date anybody over 35 and blah, blah, blah. It's like, well, you have your baggage too. So, but our culture makes and Pierre and I talk about this, that when we've heard it probably forever, men get older, they get, more distinguished. And as women get older, they get old. And it's like, well, that's not necessarily true. I've seen some very,
So false, right?
and I think
It's
that's what just irritates me. And yeah, like I said, I mean, I'm not out having to date or having to worry
yeah.
about dating, but
Mhm.
it just irritates me to hear that attitude from especially Black men acting like,
Yep.
you're over 35, so I can't be bothered. And it's like, but you're going to be the very one who get caught up in some drama messing with these young girls. But I mean,
It's just
that's just
wrong.
my
It's
pet
just
peeve.
listen, it's just wrong, It's wrong. First of all, it's false.
Yeah.
It's false. It's not true because women get more beautiful when they age. Not all of us are going to age the same.
No.
Um, but women generally start to come into this full, beautiful, extraordinary ripeness. I see it happening in women all the time.
But we have to remember, though, and Pierre says this, men look at beauty differently. So where we'll look at a woman and say she's beautiful because she's coming into this, herself and owning her own self, men might look at her and say, well, she got gray hair, she got that pot belly, all those
I want you to
physical.
tell Pierre that Auntie Temple said, I don't care how men look at women's beauty.
But I'm just,
That's actually the point. That's the point. Our beauty. No, you tell him I said this. I- that is it. He's right. But we have to have stopped caring about how men see us a long time ago, right? Because that is not what matters. What matters is how we see ourselves. And every time a man says that, we have to just laugh in their face. But it is. So once again, we're forced to be the woman of someone else's description. And so that absolutely could turn depression into suppressed rage, right? If a woman is constantly feeling that judgment of society, and I'm going to do it enough to myself. you know but that is actually it. I mean, I don't know. I would like to say I don't know how other women see men, but I see an aged man as like an old goat. So
well, they'll say, what, the greatest of all time? Goat, greatest of all time.
oh, you know what, let's scratch
That's
that. Cows.
what that's what they say. Well, yeah, I am a goat.
Listen, I'm a single woman, and everyone that knows me knows I'm single, and I'm celibate by choice. I live a celibate life, which is very important to me. It's a spiritual choice,
Okay.
and I don't want anyone calling and trying to, get me, rouse me into a date. Not going to happen. Uh,
So silly.
not only kidding, everyone. Oh my God. Last time I was in a relationship, I was young and needed the money, you know. That's a joke. That's a joke, obviously. Um, but it is, I tell you, you know, when I turned 60, my ex-husband, who I have such a loving relationship with, he sent me a message that morning. I sent him a photo of me in
Oh,
my birthday regalia, and he sent me a message. He goes, "You don't look bad for an old snaggletooth hag."
oh God.
And this is a man 19 years older than me,
Oh,
right?
wow. Oh, wow. Okay.
Yeah, so it was quite funny, but I think that I share a little personal stuff and we have a laugh. Listen, women are caring. I've never met a man, and I want to be clear, I've never met a man who said to me, "Ah, my lids are drooping, you know, or I have
Mhm.
cat, whatever that is women talk about." Uh, uh, I've never heard a man burden himself like this.
No, no.
They can have, lint in their undercarriage and not care. Yeah, no, not, don't care what they think about me.
Oh my gosh.
But that it is really right. It really is that. We do say, we look at a man and say, oh, look at George Clooney, salt and pepper, you know.
Right.
But so we really have to crush that,
We,
right?
we,
Or we do, because the depression turns into suppressed rage. We make jokes here, but more than often, right? Depression is rage that's been silenced and rerouted inward. And you and I have talked about that rage of when we never get to say, hello, I'm here.
right.
And hello, I think. Hello, I feel. So rage about unfair treatment, about abuse, about being dismissed, right? About being overlooked or fetishized, which is something where we constantly deal with this. We've seen it over the past couple of decades, this fetishization of big booties,
Right.
you know, so that, and certainly Asian women understand what that is probably right now more than any other group. It's ridiculous.
Mhm.
Um, and so over time, these feelings about what it is to be a woman
Mhm.
and the unfairness can become rage, and rage can become depression. Yeah.